off while they're infectious that they get on a plane or they go to a market. The source of the virus could be a natural epidemic like Ebola, or it could be bioterrorism. And so there are things that would literally make things 1,000 times worse. We've got cell phones to get information from the public and get information out to them. We have satellite maps where we can see where people are and where they're moving. For soldiers, we have full-time waiting to go. We have reserves that can scale us up to large numbers. NATO does a lot of war games to check, are people well-trained? Do they understand about fuel and logistics and the same radio frequency? So they are absolutely ready to go.
Dr. Fauci, let's get back to some viewer questions. Carol, who is a grandmother of 5 from Virginia Beach, sent in this video. Take a look.
Just got the first dose of the Moderna vaccine, and on February 19th, we'll get the second dose. When will we have immunity, and when will we be able to travel?
Well, you know, what the person who called that question in said, when will they have immunity? Well, you can get some degree of protection, some degree that isn't durable, you know. But we don't want people to think because they got vaccinated, then other public health recommendations just don't apply. One of the biggest things that are really not well understood is people ask, why should I even have to wear a mask after I get my second shot?
So you're saying that the vaccine does not prevent necessarily against infection. Are you saying that that's the case, or we haven't shown it yet? Do we still have to just prove this out, Dr. Fauci?
Right. We don't, Sanjay, very good question. We do not know that as a fact.
What's up, Patriots? Welcome to the CG Patriot podcast, Awake with Reason. Today is March 21st. It is Sunday, the day after Saturday. If you're just joining us here, I welcome you to this channel. Hopefully you'll like what you see and you'll hit that subscribe button below and then hit that like button. All right. So the guys that have been here before, I promised you some information on what we're currently experiencing with the push of this guy, right? So the terminology that I'll have to be using today will be a little bit different. So if you are listening to this, you might want to watch the screen, because some of this information I'm going to have to just show you on screen and not really, talk about it all too much. But I'm going to try to get around it as much as I can. I do want to share some statistics with you. I also want to get into some of the background of these pharma companies. And I want to kind of show the relationship between, if you were to launch a product, in any industry for anything, and that product happened to in the products that you launched happen to have a bad history, would you really want to put that in your body? So with that being said, let's get into it. Okay, guys, so I wanted to get into this False Claims Act first. This will give you an overview, if you haven't heard of it, into the other topics we're going to discuss, and it will all kind of lead into a full story. So, the False Claims Act, FCA, also called the Lincoln Law, is an American federal law that imposes liability on persons and companies, typically federal contractors, who defraud governmental programs. It is the federal government's primary litigation tool in combating fraud against the government. All right, and it goes on. So, how does this relate to what we're going to discuss today? So, I think the best thing to do is bring you to exactly how this relates, and then we can discuss the different VXs that are out there in some of the lawsuits that have been filed against these folks in the past that are pretty ridiculous. And it will relate to the fact that, would you trust a company like this, particularly on a fast track, to put something in your body that's brand new? All right, so let's get into it. All right, so remember, False Claims Act. So this is the list of largest pharmaceutical settlements. This is on Wikipedia, okay? So as we go down through here, you'll see this act is actually the act that most of these companies, right, like Pfizer, Johnson & Johnson, these are all part of the claims. So this is how direct this act is in relationship to all the claims that are filed against these guys, right? So basically what those false claims are, again, as it mentions in this here, it's the fraud against, in layman's terms, it's the fraud against the government, right? So it's basically, going through a process of getting an FDA approval and falsely claiming certain aspects of that of that medication. Okay. So in essence, what the government then does is use this act to protect the people at the basic form. Okay. So how does this act relate to the companies that we're talking about today? Those companies, by the way, are, let's go ahead and show those companies. So it's Pfizer, Moderna, and J&J, okay? So those three different companies. And those three different companies, they're companies that have this. And those three different companies also have some outstanding settlements that you'll be interested in seeing. So as you notice, they're all on this list. Actually, the only one that's not on this list is Moderna, because I'll tell you why. I'll tell you why in a second. So they're all on this list other than Moderna. And let's get into the first one. All right. Most people don't know this because why would they search it, right? So, and this one says, remember when Pfizer paid out $2.3 billion to settle the largest healthcare fraud in history? This is a recent article too. It says January 11th, 2021. So, it gets into this, right? It says as millions of eligible Americans rush out to get that. With Pfizer's new, right, it's important to remind everyone that back in 2009, Pfizer was forced to pay a whopping $2.3 billion settlement in what quickly became the largest healthcare fraud case in history, all right? So, it kind of speaks for itself, right? This next one. So J&J ordered to pay $2.1 billion in baby powder lawsuit. Baby powder, guys. Literally. Come on, man. So this one talks about the majority of the talc products that were out in the market. And there's a lot of back and forth. You can find a ton of different information on this. But it talks about how a reasonable inference from all this evidence is that, motivated by profits, defendants disregarded the safety of consumers despite their knowledge the talc in their products caused ovarian cancer. Okay. So, let that sink in a little bit. So let's get into the third guy, Moderna. And I wanted to show you, actually, this one first. So this company has never launched a product that was FDA approved. We all know about the first products that come out from a company that has never launched a product before. And then we just talked about how False Claims Act occurs a lot in regards to these companies that launch products and falsely make claims. Okay, so this third is actually the first that this company has ever launched, ever. So you have three options when you go get this guy. You got option number one. Okay. We got option number two. Okay. And then you've got option number three. So it's basically like you've got three options that have this history, and one doesn't even have history. And people are rushing out to get this thing. And this thing was developed in record speed, warp speed, right? So I just boggles my mind sometimes that we, as a human population, have been so magically mesmerized by what is currently going on. And most would say it's MK Ultra, right? So MK Ultra has a definitive way of producing a reaction, and you can do it remotely. And I can get into another episode on that, where some of the things that, well, all of the things that they're kind of putting us through here preps us to be easily mind controlled. All right. And that's the only thing I can think about is with why is everybody rushing out to get this thing? So I wanted to show you one other thing in regards to this one, right? So this company, brand new, they look like great folks. They probably don't even know, right? Most of the people at these companies just have zero idea of what they're, what's going on behind the scenes. All right. So welcome to Moderna. We believe mRNA is the software of life. Let that sink in. So, who else is into software? Our buddy Gates, right? And if you do a quick search, and you look for operating system, all right, guys? So Moderna operating system. So our vaccine acts like an operating system. And there's a video where the CEO actually says this. So what would an operating system do? Well, an operating system is going to allow you to implement updates and upgrades and everything that your computer does, right? So you've got an operating system, which is the base structure of your computer, or now it's your body. And if you want to go ahead and do an upgrade, and he talks about how easily this upgrade can occur. And he says it right on CNN.
Again, one of the beauties, Sanjay, of the mRNA approach is that it's highly adaptable.
All you got to do is add another little ingredient. And that ingredient doesn't necessarily have to be the base, shot.
Let's say we now want to protect against the South African isolate. You take that same mRNA, and instead of sticking in the coding component for the virus that's circulating in our own country, you just quickly stick in the one that codes for the South African isolate.
So, it's interesting. I just caught myself kind of whispering a little bit. This is the kind of state that we're in right now, guys. We're in a part of this where we have to whisper about this. We have to whisper about whether or not we want to live for the next 5 years. Okay? Because everything I've researched, that's when this stuff is going to trigger. Okay? And I've got some videos. I might be able to, I can't put them on here, but I'll try to get those to you guys in some format so you can take a look. But again, I'll put all these links down there so you can check them out. So I wanted to go over these guys. So this is called the CDC.wonder, or I'm sorry, wonder.cdc.gov. So this is the VAX Adverse Event Reporting System, or VAERS. And under here, basically, and this is all public information, under here, you can check out, and you can basically do any kind of inquiry you want, any kind of search query. What I generally do is something that allows me to actually see this information on the screen. When they return a certain amount of results, you got to download the file. So, and that's the whole process. You actually have to request it, which is interesting, right? So, anyways, this is the history by year and by vaccine. Okay. So as you go through, you'll see 1922 all the way to 1977. It was like one or two vaccines. Then you get into 1978, and there were 3 vaccines. And then there's an interesting period of time here where from 1978 to 1986, where there was 0 reported. It's interesting, right? And I was born in that time area, so it looks like a good 8 years of missing data. All right, and that basically means that nobody reported an adverse outcome. So in 1986, I believe that's the date when they had that pharmaceutical companies worked with the government to basically not be liable. They were liable, but there was a fund created so that the government would pay out the people who had adverse reactions. All right, so let's scroll down here. So again, there's a missing time period from 1978 to 1986. So we'll go down here, and in 1989, we've got 5 total. All right. Now there may be a couple more, but these are the adverse, right? So then you get into 1989, and it goes ahead and it goes straight up. This triples. All right. So it goes from 5 to 15. Actually, I think it might even be more. And then it just keeps going. So 91, we've got 15, and then same thing, 92, 93. So when it starts to get into, this is where I want to show you guys this, it starts to get real long. 1999, 2000. I want to go to 2012. That's when the longest one was. So let me go down there real quick. So in 2000, look at this, 2 screens. How many, you ask? It's around 70. So we went from 1 in 1922 to 5 in 1978-ish to 15 to 70 by 2012. 70 different VAXs. All right, guys? Okay? I didn't know this before this year. I didn't know that there were this many. I figured, there were a few. I figured there were a few because, when you get your kids, get them to have the VAX, it's not like it doesn't look like they get 70 of these. So I don't know. It's kind of crazy. But if you think about it, and then you go down to, this is kind of where it gets interesting, right, guys? So, and this is kind of where I'll end it. So this is total. This is total for 2012 of adverse reactions. Okay. So pay attention to that. That's 42, 2013. Let's keep going. Let's go to 2017. So it's 51. And what I've heard is this number, just like when they come out with the unemployment rate, this number is fudged a little bit. But again, I just want to show you facts, the things that I can show you, not hearsay. So that's 51 in 2017. So 2018, there was a spike, 62. Okay. 2019, around 60,000. Okay. 2020, it went down. So it looks like the amount of adverse reactions, and I'd imagine because of the lack of people going to the hospital and staying up to date on their VAXs and all that kind of stuff was probably had something to do with this. But as you'll notice here, guys, all right, this guy, and I'm going to blow it up a little bit. All right. Where'd it go? Where'd it go? Oh, went all the way there. Hold on a second. So as you notice, guys, 2020, the 19 had this many adverse reactions. That would be from, I think, approximately mid-December to January. All right, so from mid-December to January, we're talking about 10,839. Okay. All right, and that's 15 days. I'll give them the benefit of the doubt. 30 days. I got to find out exactly when the first person got, jabbed. So if you times that by a full year, come on, it's not like they're changing it. They're not changing the dosage. All right, so say it's 30 days that you received that many, 10,000, almost 11,000, so 11,000. Now times that by 12. 130. Okay, 130,000. So let's go into 2021, so let's go back to here. The 2020, there was a total of 55. It's interesting. So you implement a new VAX with the number that we just talked about, the 10 or 11,000, but the number somehow miraculously decreased. So as we go through here, let's look at 2021. So it is March 21st. So benefit of the doubt, 3 months into 2021. It's looking right about where it should be based upon the 11,000. So we got another week. So it looks like it's trending, right? Where's that trending to, guys? So let's take the average of, say, 60,000 a year in adverse reactions. Okay. This is where we're at right now. And look at those numbers, guys. Look at those numbers. The majority, all of them, are this. Every single one is this. 27,561. 27,971. What happened to everything else? Where'd it go? Guys, where did all the other ones go? It's the same thing they're doing, but the opposite way for the cases. They're moving numbers around, guys. Okay? They're probably reducing these so this end one doesn't look so bad. But we're on target to double or triple this from the previous year. Okay? And that's because of this guy. All right? So this is the CDC website. All right? So let that sink in for a little bit. Because it actually is just sinking in for me right now. Because I did these numbers, but the more I look at them, as you digest kind of information, it kind of starts to really hit you. It hit me just now, right now, talking to you. It's insane. It's insane. We are trending to be triple the amount of adverse reactions for 2021. Triple. And they say it's safe and effective. All right, guys. I had one of those moments when, you start to realize what really is going on here. And because the DS is bringing the heat. But when DJT, again, I think there's a bigger picture to this. But when it was endorsed the other day on Fox News, it's some kind of chess game. Something's going on. Something's going on, guys. And here's the thing. And I want to make this extremely, extremely straightforward. Is that if I was such a diehard DJT supporter, okay, or this movement supporter, and I couldn't see past the deception that's going on, then I would be blind. I'd be a blind follower of DJT. And none of us are, okay? And that's the difference between the people who are awakened and the people who are still asleep. We don't follow blindly anymore. Doesn't matter who it is. Doesn't matter who you throw in front of us. We are going to dig and dig and dig and dig. and you better be clean. You know what? We all have skeletons in our closet, but we're not running the world, okay? So, and I would imagine the majority of people who are awake are trying to help others, not deceive others, okay? And again, I'm not saying that DJT is. I truly, in my heart, I don't believe he is. However, there's something fishy going on, okay? I want you guys to know this. I want you guys to have the facts. I want you guys to send these facts to people so they can understand it, okay? So I'm going to go ahead and end this particular episode right now on that note. Need any of these statistics, I'm going to go ahead and put those links in the description below. If you have any questions, go ahead and throw them in the comments. I'll see if I can answer them. I am not an expert on this. Again, this is all public information. You can just do the research and check it out for yourself. But in the meantime, you can go ahead and check some of those links out below. And I'm going to think about a lighter topic for the next one. And if you have any ideas of what you want to hear or talk about, kind of look through my previous episodes. As I mentioned prior, I have a little bit of knowledge about a lot. So I'm not an expert at any of it by any stretch of the imagination, but I have digested probably 40 to 50 hours of information per week this entire year. That's what happens when you get locked down. So, all right, guys, you guys have a great weekend and stay frosty.